And Kevin Carroll represents Matoaca at the Chesterfield Board of Supervisors. He's with us this morning to talk about this letter that went to Governor Northam this week, outlining the problem here and looking for solutions. And Kevin, I'm glad to have you on this morning. I've read the letter. I thought it was really well thought out, not taking pot shots at Governor Northam, but clearly laying out how this is a disaster and somebody's got to get a hold of it.
Well, good morning, John. I appreciate you having me on.
Yeah.
I think the letter that we drafted is an expression of the frustration that our people are feeling in Chesterfield County. We've been, barraged by our members of the community with their frustrations as to why it's the rollout of the vaccine is being done the way it is. And, there are a lot of people who don't realize that the Chesterfield County has a health district, which is run by the state, that we're trying to work very closely with to help be very successful at this. But so the health district includes both Powhatan, Chesterfield, and Colonial Heights. But a lot of people think that the county is actually responsible for doing the vaccines, which we are now. The state is. My thoughts are a little bit simple, I guess, and that is that if I have 3,000 doses today sitting somewhere, then I need to find a way to get 3,000 people vaccinated today.
Right.
And so, the bill that Senator Donovan is pushing through, that should have already been gone through. It has provisions in there that allow for the localities to help with the administration of the vaccine. We have medical professionals all throughout the Commonwealth right now, and we'll talk specifically about Chesterfield. My doctor's office, they'd love to have the vaccine to give to the patients. They can't get any. So part of it is that we're not getting the vaccines in quick enough. But if you look at, when you talked about us being the 50th state, it's because of how many vaccines we actually have sitting. And part of that has to do with the reporting tool, and that there's a lag in how the vaccines are actually administered. But the bottom line is, if we've got 3,000 vaccines, then our goal should be to get 3,000 vaccines into people's arms as quick as possible, and be waiting for the next order to come in.
That I think is a fair assessment based on all the reading that I've been doing about what the problem is, and I do think it's important. If I don't want to blame Ralph Northam. If the federal government and the companies are not shipping enough to Virginia and they go to vaccinate people, they have 100 people waiting outside and there's nothing left in the freezer, that's one problem. But if there are doses sitting in the freezer and they're not being administered, well, that's a very different problem. It sounds like it's the latter here. You also point out in your note the decision to aggressively vaccinate certain people over other people, specifically those who are in congregate settings in jails and prisons, which I think is becoming a problem. I mean, I don't think anybody who's a decent person is going to say, hey, because you got locked up for stealing some tennis shoes or stealing a car, you should be the last in line to get the vaccine. But at the same time, maybe we should prioritize the 75-year-old lady at her home above the 30-year-old who's in the congregate setting in jail. What's your analysis of that as you have seen in Chesterfield?
Well, I mean, we've been very fortunate in Chesterfield. We have not had the cases of COVID-19 in our jail. And I think that the localities and certainly the sheriffs need to have some leeway in determining what we feel the priority is for their jail population. If you're not having an issue and you can get those shots into the older people in your community or your teachers, so you can get your firefighters and your police officers, so you can maintain public safety and get your kids back in schools, then I think that needs to take a priority. I mean, we had an 80-year-old gentleman that contacted me yesterday that made an appointment and went down for it. And by the time he got there, the doses were gone and he got turned away. And hopefully he'll get back in there today. But when you look at the numbers Yeah, I mean, when you look at the numbers, our deaths in Chesterfield County, anybody ages 80 plus, that's the majority. Anywhere from 60 and older, those are the majority of the fatalities that we've had happen in Chesterfield County. 113, 80 plus of our people have passed away from this. And it's no joke. We all know that. I've had several friends that have gotten it. My sister's in the hospital with it right now. And so it's not something that you can take lightly. People need to wear their masks, need to socially distance, need to respect each other. But, again, let us help. Let us help. We have people in the community that are medical professionals, I'm sure, would say, what do I need to do to help here? Do I need to come down and volunteer to help? We have our nurses in the schools standing by, ready to vaccinate our teachers and our children. But we have to have the doses to do it. And what we're saying is, we need to find a better way to distribute this, and we also need to have a mechanism to do it faster.
Here's my big question. You've sent this letter. It's a pretty formal letter, thorough, not a political hand grenade necessarily, but something seriously laying out your concerns. Have you heard anything from anyone in the governor's office?
Well, I actually spoke with Joe Casey just a few minutes ago just to verify, and we did get a tweet response from the governor's office yesterday. But as far as someone actually picking up the phone and calling Joe Casey or calling someone on the board, to my knowledge, no one's done
What'd the tweet say?
I guess I could send you a copy of it, but it's, the governor shares the frustration in Chesterfield and across Virginia that the national vaccine supply is currently so limited. The entire Commonwealth, which includes 133 different localities, is currently receiving about 105,000 doses per week. And it goes on, and it's it's a tweet. It's a response. I think we probably would have warranted a phone call, but okay, what do I know? I think that there is a problem with the amount of doses coming in, but we shouldn't have doses sitting around.
That's the issue.
I'm a simple person in the sense that if you get 105,000 doses in per week, our goal should be for 105,000 doses to be in an arm by the end of the week and be ready for the next ones to come in.
Yeah, they're two different issues, and I don't want to play politics with it. It sounds like you want to be sober and honest about this too. Two different issues. One is the supply that's coming into the state, and the other is the distribution. And I can't do anything about the supply. Maybe that will be resolved, but something's not working with the distribution. And I have to tell you, I was hoping you would tell me, oh, yeah, John, I got a phone call last night, or we got a phone call last night from the governor's chief of staff. They've heard it, and they're going to announce this morning that they're having an emergency meeting where they're going to figure all this out. Maybe that's happening, but I don't understand why this isn't an urgent thing for them.
Well, I think they said they're going to talk about it in the upcoming press conference, which I think is going to be held today.
Yeah.
We have facilities all through Chesterfield County that are offered up to, Virginia State University would be a great location to have, be able to do vaccinations. We could cover people in Colonial Heights at the same time because they're all part of this health district. We could do John Tyler Community College up in the north end of the county, or the old Sears, which is sitting vacant up at Chesterfield Town Center. We have buildings in Chesterfield County that we could help if we and try and find people to help staff this.
Right.
But it doesn't do any good to have the buildings if you don't have the vaccines put in people's arms. But I think people would come out of the woodwork, medical professionals, to help. The other night we had we've been scheduling our public safety people. I went over to our public safety training center, and I watched our police officers getting shots, and at the end of the night, they had 2 shots left, and they came up to me and said, we got an extra shot if you'd like. I said, no, find somebody else. Go find a cleaning staff or somebody else who needs to get the
well, that's good of you. I got to go, but I'll tell you, I don't want to turn it into a scandal, but I have this awful feeling we're going to find out that other elected officials and kind of that they haven't been as gallant as what you
we
just
have.
told us.
I can tell you, we all have in Chesterfield. But the last thing I want to say is to the people who are listening, we're doing it right now. The state's doing this by appointment only, so don't have the expectation of coming down to the county today, as it happened yesterday, and thinking that you're going to be able to get a shot. It's by appointment only, and there'll be sheriff's deputies there checking on who is on the list. But we're hoping that we can get this thing working quicker and hopefully the state will help us.
All right. Kevin Carroll from the Chesterfield Board of Supervisors representing Matoaca. I appreciate the chance to talk to you. Call me back if you get new news. Thank you, Kevin.
Sure will. Thanks, John.